Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Amanda Cook with the Society for Nutrition Education, and thank you for your patience this afternoon as we resolve some of our audio issues. We wanted to make sure that you could hear the presentation clearly, so we're going to get started right away. You may ask questions throughout the presentation using your questions panel on your GoToWebinar box. You can ask those throughout, and Lisa Sanders will moderate those for us at the end. So we're going to get started right away. So Lisa, go ahead.
Thank you. Hello, everyone. Welcome to the webinar, Going with the Grain, Solutions to Achieve 2010 Dietary Guidelines Fiber Recommendations, and we thank you for your patience with us. I am Lisa Sanders. I am a Senior Nutrition Scientist at the Kellogg Company, and my primary area of focus is in the area of dietary fiber. I did want to let everyone know, just to remind you, you do get 1 CEU credit for today's webinar. And just to let you know a little bit about Kellogg, Kellogg did launch the first high-fiber cereal in 1906, and we've been a leader in that area ever since. And in fact, we have more ready-to-eat cereals that have at least a good source of fiber than any other food company. And so we are ramping up our fiber leadership in addition to that with a renewed commitment to increase the science and awareness of fiber. So another reason for our webinar today. To go through just briefly the objectives of what we plan to get out of this webinar, we want to help you understand the new guidance for dietary fiber based on the 2010 Dietary Guidelines for Americans. Fiber was listed as a nutrient of concern. And so we want to help you understand what the new guidance is. We also intend to broaden the knowledge of science behind fiber sources and also the role of added fibers and how they can help us close the fiber gap that so many Americans have. And then finally, we want to provide you with some practical solutions that can actually help you with your patients and with your clients to help them better understand fiber sources and where they can find fiber in their diet and on the grocery shelves, and as well as how to help them meet their fiber intake goals without significantly increasing their calories. So those are our overall objectives for today. I'd like to introduce our speakers now. Our first speaker is going to be Dr. Joanne Slavin. She is a professor in the Department of Food Science and Nutrition at the University of Minnesota, and she was also a member of the 2010 Dietary Guidelines Advisory Committee. So she is an expert in this area that we're going to be talking about today. In her laboratory, she is involved in research on dietary fiber, carbohydrates, and satiety, as well as whole grains. She's authored more than 150 scientific publications and numerous book chapters and review articles. Dr. Amy Mobley is our next speaker, and she's a clinical assistant professor in the Department of Foods and Nutrition at Purdue University in West Lafayette, Indiana. And there she's responsible for teaching courses on dietary selection and public health nutrition. She also conducts research on nutrition education and communication and health behavior, particularly in a community setting. She works with SNAP-Ed, which is Supplemental Nutrition Assistance Education Program, that evaluates the impact of new project initiatives for low-income individuals, such as a social marketing campaign to increase the consumption of milk and milk products. Also, it works with web-based nutrition education and childhood obesity prevention. So she also directs Indiana's Food for the Hungry program, which provides education and training to emergency food programs in Indiana. So with that, I will turn it over to our first speaker today, Joanne Slavin.
Thank you, Lisa. It's great to be here. I'm going to start out talking about the 2010 Dietary Guidelines for Americans and the process of getting to those dietary guidelines. This slide talks about the whole process, and so often people say, well, what's the big deal? What takes so long? But you can see, first of all, the Dietary Guidelines Advisory Committee is chartered, and there are 13 members of that committee. The process is very open. There are public meetings. Anyone can submit comments. And then last June, the Dietary Guidelines Advisory Committee advisory report was submitted to USDA and HHS. And the point on the bottom there is that this is the first time a evidence-based methodology was used to review the science. So it's very available to you if you want to go in and see what kind of data was in every question that was asked. That would be available. Then the dietary guidelines for Americans are actually written by USDA and HHS, and that's what was just came out on January 31st. And then that last step is still to be done, where the dietary guidelines have to be implemented in different types of programs. So what's different? What's new? So often people say, well, there's nothing new. Well, there are some changes, I think, that are significant. There was a real effort to make the messages quite simple so consumers could get them. And so a lot of emphasis on behavior and eating occasions. Just that nutrients are important, but things like eating breakfast are also very important messages that we want to get out. The other thing that's different is that the discussion was that the average American isn't healthy. They are overweight, so there was more of an emphasis on let's deal with that rather than assume everyone is healthy. It's hard to say eat less because we want people to get all the nutrients they need, but there is an emphasis on enjoying your food but eating less of that food. There's also a discussion on the ecological model. So talking about how we know about nutrition, that's important, but what gets food to people? So all the parts of the environment, the food industry, policy that give consumers reasons and help to actually eat better. Some of the direct recommendations, balancing calories, making sure that people are not eating too much, striving for nutrient-dense food, so when you eat a food, getting as many nutrients as you can per calorie, and being active. So without that, we just don't have much room at all. And just this idea that food is to be enjoyed rather than just prescriptive. So I think everything's going quickly. Some of the recommendations on fiber, wow, everything's moving very quickly. Let's see. I'm not sure who's got control, but I don't. Okay. So dietary guide, next slide, 2010 dietary guidelines, balancing calories, eating less, avoiding oversized portions, fruits and vegetables, switching to low-fat milk, and things to reduce. So sodium, choosing foods with less sodium, and drinking water as compared to drinks with higher calories because of their sugar content. There's no surprise that in the dietary guidelines, fiber is a nutrient of concern. And if you look at all the data, it's very consistent that 5% of people actually get the amount of fiber that's recommended. So 95% of adults and children don't get the recommended amounts of fiber, which will have some health consequences. So in general, we only get 15 grams of fiber. And if you look at recommended levels, depending on males versus females, it's anywhere from 21 to 38 grams. So in general, people get less than half of the amount of fiber that they need. So why is fiber important? Well, fiber is essential because we know there are links with different diseases. So the number one thing that is obvious is that higher fiber diets protect against coronary heart disease. So the data on this is very clear that people that eat more fiber in prospective studies have less heart disease. We have certain fibers we know help lower cholesterol, oat bran, barley, psyllium. These fibers actually help lower cholesterol, which would have a role. We all know that laxation is important. Stool more fiber, they tend to feel fuller and can go longer between meals. Cancer risk, there's lots of data on cancer risk with fiber and lots of controversy, but no question for sure cereal fibers are protective against different cancers, especially colon, but also breast cancer. And then type 2 diabetes, also cereal fiber, very protective in the prospective studies on that. So when we look at all the diseases in the U.S., obviously it's important to
Amy, are you still on, or did we lose your connection? Or Joanne? I apologize. It sounds like we might have lost Joanne. So
I am back.
Oh,
I'm not sure what happened to my line, but I am back. I'm sorry.
Joanne, wait, Joanne. On your audio panel, please select Use Telephone because we hear you twice now.
Okay. All right.
Yes, thank you.
Okay. Trying to get people to eat more fiber, so fiber is a shortfall nutrient. Whole grains are the most important source of fiber grain products, so getting people to consume those is very important, but not all whole grains are good or excellent sources of fiber. So those really are both important messages, more whole grains, but also selecting whole grains that are high in fiber. A lot of fiber comes into our diet as functional fiber or added fiber. And those fibers have important physiological effects, whether they lower cholesterol, are effective for things like prebiotic effects. So those fibers are starting to get into as part of the solution for adding fiber to foods. What's good about high fiber foods is typically they're lower in calories, they have more water, so calorie density goes down. There's some surveys just looking at what do people know about fiber. People know fiber is important, so it's important to communicate it, but there's lots of confusion on different fibers. And there's so many fibers out there, people think, well, if these fibers aren't really bad tasting, maybe they're not very effective. So there's lots of confusion and lots of misinformation on different fibers. Most people know that fiber is added to the diet, and it's important because of the fiber deficit to do that. But there's still lots of confusion, and some of that confusion has to do with just fiber and whole grain, both important concepts, but somewhat confusing to people because you could consume all whole grain products and still not have enough fiber in your diet. A lot of people think that fortified foods are not as good as other foods, and most of the data we have actually shows that these isolated fibers are the ones that do have an effect. So even though people are worried that they don't have physiological benefits, there's a lot of data on isolated fibers having important physiological effects. So why is there this lack of confidence? I think some of it has to do with the idea that we need to get fiber all from natural food sources, but because of the amount of foods you have to consume to get that, that can be difficult. So, and the concern that functional fibers are not as effective. So just a little bit on definitions. Added fiber is fiber that's added, but then dietary fiber is the fiber that's naturally found in plant foods, so whole grains, fruits, vegetables, legumes, any type of added fiber or functional fiber. It can be extracted from fruits, vegetables, legumes, seeds, any type of plant product. It also can be manufactured from different types of starches, resistant starches being an example. And so then the total fiber is the sum of dietary fiber and functional fiber. Looking at fiber and whole grains, so really important messages, both of them important, but some whole grains are not high in fiber, and we all accept brown rice as a whole grain food, but it's not a high fiber food. So brown rice is a great selection from the whole grain side. It doesn't give us a lot of fiber. If you look down the category, some of the things that are listed there, oatmeal, absolutely great source of soluble fiber, is a whole grain, but 2 grams of fiber. So getting up to that 38, there's a long way to go. So if you look down all the things, a lot of whole grain products are not going to be high in fiber. So really important to get both those messages out. Eat at least 3 servings of whole grains, but also choose high fiber whole grains and think of additional ways to get fiber in the diet. So where do we get fiber? So often people say, well, it comes from fruits and vegetables, but most fiber sources only have like 1 to 3 grams per serving. So if you look at usual intakes, they come from lots of products. So, you know, potatoes, white bread, things you don't think of as fiber sources often are the most rich fiber sources in our diet. So because fiber comes from lots of different products, and in general, we only get 14 to 15 grams, we need to add fiber to many products to get up into those recommended levels. So how do we do this while still balancing calories? So if you look at the dietary guidelines, a big emphasis on not adding calories, actually subtracting calories. Fiber goes with calorie intake. So people that eat the most calories get the most fiber. So it's a real challenge to get both those things, move fiber up and move calories down. So I want to talk a little bit about some research trying to get at that. How do we increase fiber in the diets of Americans, looking at what people actually already eat? And the NHANES is a great survey of looking at where people are at, what types of foods they already choose, to see what kind of changes we can make to actually increase food components that we need to increase in their diet. So some of the methods, looking at the baseline, mean, usual intakes, and then looking at different simulations to see what would happen if you make some changes. So let's say we increase all fiber-containing foods, so fruits, vegetables, and grains by 10, 25, 50, or 100%. What will that do? The second thing, increasing fiber content of low-fiber grain products, so get them up to be a good source of fiber, which is 2.5 grams per serving, or an excellent source of fiber, 5 grams per serving. And then number 3, increase currently available whole grain foods to meet recommendations to 1/2 of the total grain servings, maximum increase of 5 times the current intake. And then what's the impact of the calories when making those changes? So this is a modeling example. If we make those changes to get what we want, how does it affect calories? So the bottom line, if you want to meet your daily fiber goals, you could increase your consumption of foods with fiber, which is over 1,000 calories, which is not what we would like. If you increase consumption of whole grain foods as people select, that's an additional 1,266 calories each day. Or if we add fiber, the fiber that can be added to foods that people are already eating, we can get calorie intakes up with no extra calories. So with the incentive to keep calories lower, get calories lower, and get fiber high, I think added fiber has a definite role in the diet. So implications, foods with added fiber help close this fiber gap without affecting overall calorie intake. And food manufacturers can reformulate products that people already like, people are already going to eat with added fiber, and that will help without increasing calories to get fiber intakes closer to where they need to be. Where is fiber? It can be added to lots of different products, and that's a nice thing. Even if people don't like cereals or grains, fiber can still be added to dairy products. It can be added to different drinks, different bars. So it's really looking at what people are willing to consume, what they are consuming. Different fibers and different fibers with different physiological effects can be added to those products. So some of the benefits, so often people say, yeah, but those fibers don't do anything. And that's absolutely wrong. If you look down the list on the isolated fibers, we'll go down the list of all the isolated fibers that are available. This is just a partial list. Some of the beneficial roles of those fibers and where they actually come from. So just to give you a couple of examples, cellulose is isolated. No question it works on laxation. It can be isolated from all plant foods. Guar gum definitely lowers lipids, attenuates blood glucose, comes from a guar bean, which is a legume. I think inulin, oligofructose, has some GI function roles in the body, comes from different sources. So throughout this, so often people will say, well, I don't recognize that polydextrose. I don't know that that's a fiber. I don't understand that. But if you look, there's data out there that polydextrose has a role in laxation, increases stool weight, helps prevent constipation. So these added fibers have been studied, shown to have beneficial physiological effects.
Okay, well, this is Amy Mobley joining you now, and I would like to thank Joanne for really setting the stage and providing us with a solid background as it relates to fiber and some of the new information in the new dietary guidelines for Americans. So now I'm going to switch gears, and I'm going to talk a little bit about turning the dietary guidelines for Americans recommendations as it relates to fiber into actions for your patients and or clients. So as health professionals and or nutrition educators, we often use terms such as soluble fiber, insoluble fiber, or the more current terms, functional fiber, dietary fiber, among many other terms in maybe our day-to-day language. But what consumers are really hearing are just fiber, 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 fiber. They're not really thinking about or hearing some more specific terms, so we do have to be very cautious in the way that we communicate with our clients or patients, thus consumers. So with that, the Dietary Guidelines Alliance, and as well as Kellogg, has done some consumer research related to messages when we're trying to communicate more about fiber and or foods in general. And what the Dietary Guidelines Alliance, which is a group founded by the International Food Information Council, found was that when it comes to motivating positive diet and lifestyle behavior changes, parents and adults really report that they prefer recommendations that are instructional, that give them that action-based guidance. And they are more likely, these messages, to be read and remembered, so they are more attention-getting, possibly saved and discussed with others at a later time, and perceived as personally relevant. So we need to keep that in mind as we're communicating this information to our clients and patients. With that testing, Kellogg's did a study with over 1,000 individuals to test different types of messages related to grains and fiber. So they had different sets of messages, and they tested them to see what resonated the best with the consumer. One of those messages, as it relates to whole grains, was make your whole grains count. Choose at least 3 servings of whole grains with at least 3 grams of fiber per serving. So when it comes to whole grains, as Joanne mentioned, not all whole grains are necessarily good sources of fiber. So this message is not only communicating to make your whole grains count, but it's specifically communicating to have those 3 servings of whole grains, and that those whole grains also have at least 3 grams of fiber per serving. The second message that resonated the most with consumers was make the most of your grains in general. Choose grain foods that provide at least 3 grams of fiber per serving most often. So while half of the grains should be whole grains, there's going to be other grains that people are consuming. So the message to communicate is to make sure that those grains also are good sources of fiber as well. And that's exactly what this message did in tandem. So why were these messages preferred as it relates to fiber and whole grains? Why did they work? What we were told is that these were really easier to understand, and they were more action-oriented. In addition, they were simpler, meaning that they gave specific direction, 3 grams of fiber per serving. And they used terms that individuals were familiar with. Refined grains wasn't one of those terms. That's a bit of a challenge. But terms such as grains and whole grains was more recognizable by the consumers. Why did these messages matter? Well, because fiber, one, as we all know, is essential to good health at all life stages. And Americans do need to increase their fiber intake. Most Americans, or most consumers, say they're trying to get more fiber in the diet. However, the majority are still falling short on their daily fiber needs. And as we've already mentioned, not all grain foods are created equal. So Americans do need help looking for those high fiber grains. And actually, nearly half of ready-to-eat cereals that have some sort of on-pack whole grain claim do not necessarily meet criteria for even a good source of fiber. So that education is definitely needed among Americans and consumers in general. So what are some of the challenges as it relates to closing the fiber gap? Some of those challenges relate to perception. That could be perception to the taste. There could be a negative connotation to the word high fiber, or possibly to foods that somebody may not be familiar with. So some of the naturally occurring high fiber foods, if somebody's not familiar with those, they may be less likely to try to taste them, or it could be a reformulated food that has added fiber that they may not be accustomed to, possibly. It's hard to say, but taste could be a possible barrier because taste is the #1 driver when we're making our food choices. Another perception could be related to the color of the grain, and this can go either way. Some individuals mistakenly think that a food is a whole grain because it's darkly colored, and that is not necessarily true. So that's where we have to do some education. But at the same time, if a food is a whole grain and it does have a dark color, it may have a negative perception. There has been some research, some focus group research with young children who perceive some whole grains as being dirty. So that almost had a negative connotation, and that they may be less likely to eat those foods. And then the perception as it relates to cost. It may be perceived that eating a nutrient-rich diet or a high-fiber diet has to be expensive, and that's not necessarily true either. So some education and some skill building may need to be emphasized. At the same time, food selection. Currently, there is not a standardized labeling system as it relates to whole grain labeling. There is a whole grain stamp, but it's not a universal stamp, and some individuals may not know how to use that stamp on certain food products. And at the same time, individuals may not realize that they should be looking for food sources or grains that are at least 3 grams of fiber or more. And if they're eating out, they may need some education or skills on asking for or seeking out foods that are higher in fiber. So that is just another challenge. And in addition, some individuals, especially those that may be from a limited resource audience, may not have these foods available in their community. So availability does become a challenge. So what can you do? Well, one of those things that you can do, of course, if you're part of the Society for Nutrition Education, is educate. You can help educate your peers of the benefits of fiber-fortified foods. Hearing some of the information today about there is benefits to foods that have added fiber, and it's really a tool for meeting consumers where they are. If they're already eating a familiar food and now it has added fiber to it, we're really meeting them where they are. And at the same time, if you have educational strategies of how you can help your clients or patients or just the public in general increase their fiber intake, peers are always looking for that type of information. Your clients and patients themselves probably need some help and education. One of those areas is label reading skills. You may have to help them more identify how do they know if something's a whole grain. How do they know something's a good source of fiber? So showing them the information on that food label and how to interpret it is a skill that will be helpful. At the same time, if they're maybe hesitant to try a new food or they're not familiar with the food, having some sort of recipe demonstration or food sampling built into your education can be very helpful to getting them acquainted with that food. And we know this mostly with children, that it takes several times before a child is willing to try and adapt a new food. And that kind of goes the same along the line for some adults for new foods as well. It may take just a recipe demonstration or food sampling to really encourage them to try a new food and incorporate it into their diet. And then a last group of individuals who sometimes we forget about are policymakers. We may need to talk to them, educate them more about the need for some sort of consistent whole grain labeling system, especially identifying whole grains that are good, at least good sources of fiber, because not all of them are. Some sort of handy system that is universal that consumers can use. And at the same time, ensuring that our food assistance programs or those other types of programs that provide foods or supplemental foods are also including foods that are good sources of fiber. And lastly, as I somewhat already mentioned, ensuring that there are areas in this country that are considered currently food deserts that actually have food places for individuals to purchase these items. I know there's been some action in this area, but there's a lot more that we need to be doing to ensure that individuals actually can have access and can purchase these types of foods for their diet. What else can you do? One is, of course, being a champion, helping to take these dietary guidelines for Americans into action, translating the policy document into information and messages for your clients and consumers. In addition, as we all consider foods, all the foods with fiber, the standard fruits, vegetables, legumes, as well as grain products with at least 3 grams of fiber per serving, that they're all part of encouraging consumers to really help meet their goal as it relates to fiber. And then, as I mentioned, the food demonstrations or the food sampling, you may want to think about partnering with a local grocery store or a food manufacturer to see if you could get some coupons. Sometimes those are mailed out automatically to some health professional groups, but that could help you influence or encourage your patients or clients to try some of these new products. And then having a coupon or a free sample, then this way they may not be as hesitant to try something with their own money. So what should you tell your clients? As we've already mentioned, and as I think we already know, encouraging them to eat more whole grains, more fruits, more vegetables, and legumes. You'll probably have to take this one step further in terms of translating this information into action-based steps. For instance, choosing fruits as snacks or vegetables as side dishes. If they have never really consumed legumes, how do they actually go about cooking a bean, and what do they do with it when they're done? So you may have to help them with that specific type of information. And when purchasing grains, encouraging them to flip to the actual label on the product and looking at the fiber content and ensuring that it is a good source of fiber. So using the % daily value or the actual amount of grams, whatever is going to work best for that consumer and helping them understand and selecting products. And at the same time, if it's a whole grain, paying attention to that information as well so that they're aware. And as we've already mentioned in the presentation, that it's important to communicate that individuals increase these foods in their diet, but at the same time balancing their calories. We have to be careful about the message of just adding foods, because if they're just adding foods and not substituting foods, they could possibly be adding calories at the same time. So I'm just going to show an example here on the next screen of a meal plan. And this meal plan is not necessarily an ideal meal plan by any means. It's the meal plan number 1 here on the left side of the screen that shows a breakfast, lunch, snack, and dinner. And on the right side, it is with 2 simple substitutions of 2 of the grain items in the meal plan. And so by going from a 13-gram total fiber diet to a 26-gram total fiber diet by making these 2 swaps. So instead of the sugar-coated flake cereal, substituting a Kellogg's Frosted Mini Wheats for that can boost the fiber intake by almost 5 grams for just that breakfast. And then swapping the chocolate chip cookies for something like a Kellogg's Fiber Plus chocolate chip bar would increase the fiber by over 8 grams of fiber. So it's essentially doubling the fiber intake but maintaining the calorie intake for the day, and therefore meeting this individual's fiber needs if they were around about a 1,600 calorie diet for the day. So just by these 2 simple changes in the diet can boost the fiber by double. Some other examples of small steps to increase fiber and also improve food choices could include, this is the same initial meal plan, adding a small apple to the menu could increase the fiber content by about 3.5 grams or so. Changing the pasta from a regular enriched pasta to maybe a whole grain pasta, that was a good source of fiber as well, could increase the fiber by possibly 3.5 grams. Substituting the potato chips currently in the diet with maybe a half a cup of baby carrots could not only increase the fiber intake, but also add a serving of vegetables to the diet. And then switching the romaine, or switching the lettuce to a romaine lettuce, or adding some tomatoes to the lettuce could also increase the fiber slightly. And then lastly, adding a cup of low-fat or fat-free milk or a half a cup of low-fat yogurt doesn't necessarily add fiber, but it rounds out the meal choices in the meal plan in terms of improving the quality of the diet. So these are just some other examples of increasing fiber and improving the nutrition quality of the actual diet. So I'm going to just talk real briefly here about some resources available to you. The first one, actually, Lisa's going to talk about right after this slide, is more specifically about some of the Kellogg specific resources that are available related to whole grains and fiber. The dietary guidelines themselves are available online. They were released at the end of January, and the guidelines as well as some consumer messages are available for download. You could take a look at that more closely. The American Dietetic Association has information for health professionals as well as consumers. They also have a position paper on fiber that can be downloaded. My pyramid is the more personalized information based on the dietary guidelines. So if somebody wants to know specifically how many grains they need, how many whole grains they need, what is in whole grain, there's more information on that website. The National Fiber Council is a group that's dedicated to increasing the fiber intake of Americans, and they have some resources as well on their website. And then the International Food Information Council has information not only about creating effective messages for consumers, but they also have some fiber-specific messages as well. So these are all resources available if you need more information on this topic.
Well, thank you so much, Amy. I appreciate both Amy and Joanne joining us today and sharing their expertise with us. I did want to briefly review the resources that are available to you on the Kellogg Nutrition website, kelloggnutrition.com. What's highlighted on this particular slide is some materials on closing the fiber gap with options and variety. This gives science and background on some of the added fibers that were discussed today. And actually, one of the leading fiber experts, Joanne Slavin, who spoke with us today, was instrumental in helping us to put this together. There's also a fact sheet called Fill Up on Fiber in the Fewest Calories, which includes the sample menus that Amy included in her presentation earlier, that gives just a few simple ways that you can make some changes, small changes in your diet to increase your fiber without adding many more calories to the diet. Some other resources just to point out that are also available on our website. We have a fiber continuing professional education program that you can actually get a free CPE credit and learn about fiber in the process. We also have a turnkey, ready-to-use presentation on fiber that you can use with your patients or clients, and some additional resources and fact sheets on whole grains and fiber. We have a Fiberpedia that's great for healthcare professionals that gives a lot of information about fiber. There's also a collection of recipes bringing fiber to the table for you to give to your patients and clients to help them with recipes to get more fiber into their diet. Those are just some of the examples of the resources that are available on that web page, kelloggnutrition.com. Another thing that we do have is called the Know Network, so you can sign up to be in the know. That's on this next slide. And basically, this is just a monthly email newsletter that would come to you containing the latest nutrition news, research findings, industry insights, product and program updates. Also, as Amy mentioned in her presentation earlier, a great way to get consumers to try new products with fiber is to provide them with coupons. And so if you send an email to this email address that's listed, know@kellogg.com, we can get some coupons out to you that you can then use with your patients and clients. And just to let you know, we would need a mailing address for you to receive those coupons, but just send an email there and we can get those out to you. With that, we are now going to open it up to questions. There is a question box for you to enter questions as you have them. We've been getting a few along the way, and I will go through some of these and ask them, but please feel free to continue to ask questions. We did get a question about, a couple questions actually, about gluten-free and celiac disease and what is available, some products that may be available from Kellogg's that are gluten-free or for celiac patients. I will say that right now there is nothing available on the market, but I would say stay tuned in the next few months and you may see some things showing up. Let's see, don't have that many other, here's a question that just came in. What about the role of dry beans in adding significant fiber to the diet? It's not necessarily a whole grain, but a great fiber source. Would any of our speakers like to comment on that?
I would be happy, this is Joanne Slavin, to comment on that. We did, if you read the Dietary Guidelines Advisory Committee report, we did do a search, an evidence-based research on dried beans and peas. And there isn't a lot of data, unfortunately. There aren't a lot of studies on physiological effects of fiber from dried beans and peas. I think that there's some data existing that those fibers tend to be more soluble, but one of the problems in our epidemiological studies is people eat so little of it, we just don't get much of a read on what the effects are. So I think that one of the things that Amy talked about is getting people to try. Most people just don't have much knowledge or much information, so the usual intake in the U.S. is really low. So it's more of a nutrition education, I think, than nutrition science to get people to actually use legume products. I do think there's been some effort. There's some isolated legume fibers that have been added to products, so I think there's some opportunities there.
And just to reiterate what Joanne said, this is Amy. She's absolutely right. Obviously they are a good source of fiber, but one of the barriers in terms of people eating them is sometimes, especially the dry bean products, they don't know what to do with them. They don't know how to cook them. They don't know how to incorporate them. They may not have never eaten a bean before, so they may be hesitant to even try it. And it's one of the foods that in emergency food programs such as food pantries sits on the shelf the longest because people won't take it because they don't know what to do with it. So we try to do in our outreach is, recipes and how to actually utilize those foods.
Okay, we have some other questions that are coming in. A question that says if you just rely on the added fibers and don't start with the whole grain, do you lose some important vitamins that you would have had coming from the whole grain?
Well, I'll take it. This is Joanne Slavin again. I think one thing we always forget is that whole grains, what's in them, typically fibers, they're leading sources of fibers. A lot of vitamins are not particularly high. They're actually a little higher in minerals. And generally, too, if you look at a lot of the breakfast cereals that are available, you would get more vitamins from fortification than you would from actually the whole grain. So I always like to point out that we don't want to compete whole grains versus fiber. They're really both important messages. So getting people to eat at least 3 servings of whole grains per day is an important message, but fiber is a nutrient. We need people to get that amount, and so I think the combination is the important thing. So we're not just don't want to say, well, fiber is the important thing. They're really both very important messages to get out.
Do you have any advice, this is for either of the speakers, on how to encourage clients to, when they're trying to keep an ingredient list to a minimum, but you want them to include fibers such as these newer fibers, psyllium or chicory root, etc., when the clients are unfamiliar and these seem like unnatural ingredients? Any advice on how to encourage clients to include these fibers?
This is Amy. Just to clarify, I'm interpreting that to mean that if they picked up a food and it had some of those ingredients, that they wouldn't be dissuaded from trying it. Am I interpreting that right? What can we do to encourage them?
Right. That's what the question sounds like, is how to encourage them to get the fiber when they're trying to keep ingredients to a minimum.
So if they are concerned about those names on the ingredient label, I would say it goes back to some education and letting them know that these are isolated sources of fiber and they are still beneficial to their health. So it may be some education about some of the terminology is one suggestion.
This is Joanne Slavin, too. I'd kind of like to mention that so often people say, I want a very simple label with just 1 ingredient or 2 ingredients. And actually the trend in fiber is to go with different fibers because different fibers have different effects. So you might have a fiber product where inulin is put in and polydextrose and soluble corn fiber, and I would consider that a positive, not a negative. So to convince people that different fibers do different things, we need to get fiber into products. So the fact that there are 2 or 3 listed on the label is actually good.
Great points. One question, this is a question I would think is fairly common. Are the functional fibers as good for the body as natural fiber?
Well, this is Joanne. I'll take that. There's many more studies on functional fibers because functional fibers have to show that they have some physiological benefit. So you look at a fiber oat bran, there are many, many studies that show it will lower your cholesterol. Psyllium, many studies that show it lowers your cholesterol, increases stool weight. Some of the newer fibers I've talked about, dextrose, soluble corn fiber, have studies, published studies that show that they're physiologically effective. So, for clinical studies, the functional fibers, many more studies there because we really have a hard time doing studies with whole foods and giving you enough whole foods to measure a change in laxation or cholesterol lowering. So it's another thing that we don't want, there's no question we want you to get fiber from foods, and emphasizing the foods that hopefully have come out during this presentation, fruits, vegetables, whole grains, legumes, very important, but still with the number of calories you have, people aren't going to get there probably unless they can eat a lot of foods without some added fiber. So I think that's the important part with functional fibers, and that these functional fibers, although they're different, they do have physiological effects that are positive.
Okay. We might have time for one last question because we're almost out of time here. But last question, what is a simple way to explain the benefit of whole grain products since they aren't always high in fiber?
I think it's just dietary guidance. Like we know that whole grains have health benefits. The studies are very consistent, the epidemiological studies. So lots of things come along with whole grains, minerals, phytochemicals, fiber, really good guidance to get at least half your servings of whole grains.
And I would agree. I would, communicate the same, that whole grains have benefits beyond fiber for preventing disease.
Okay. Well, I think that we have come to the end of our time. We did get some questions about the slides being available, and I do believe they will. The coordinator of this webinar, I believe, has access to these and will make them available at some point. But I want to thank you all for participating today. I hope this was helpful to you. Again, be sure to check out Kellogg's Nutrition for some fiber resources to use with your patients and clients. And thank you for joining us today.
Yes, thank you, Lisa. This is Amanda with S&E, and thank you, everyone, for joining us today. Again, thank you for your patience while we tried to work out some of our audio issues earlier. The slides will be available, and they'll be distributed to you following the webinar in a follow-up email, along with your continuing education credit certificate and an evaluation for today's webinar. So please take a moment to fill that out. And we have webinars. We have 2 more webinars coming up in April, so look for details on those coming soon. Thank you, everyone, and have a great day.